Evening. Thank you for joining us for our webinar on support for primary care providers after the severe weather and floods New South Wales East Coast. My name is Phoebe James and I'm a Professional Development Officer with the PHN. Before we begin, I would like to acknowledge the traditional custodians of the lands that I live and work on. For me here in Newcastle, it's a Awabakal and Warramai land, and pay my respects to elders past, present, and any First Nations people joining us this evening. Just a few housekeeping things. This session is being recorded. The recording will be available in the Education Library on the PHN website in the coming days. At the end of the webinar, you will receive an evaluation. Please fill this in as it does provide us valuable data. If you have any questions for our presenters, please put them in the question box as we will have Q&A at the end of the session, and that's going to be facilitated by our very own Ellen Senft, Manager, Disaster and Emergency Coordination at the PHN. It's now my pleasure to introduce Richard Nankervis, CEO at the PHN, and Lani McNeil, Manager, Social Recovery Coordination, New South Wales Reconstruction Authority. I will now hand you over to Richard. Thanks, Richard.
Great. Thanks, Phoebe, and thanks everyone for joining. I would just acknowledge everyone who's been impacted by the floods and this severe weather event, and our hearts are with you, but we really appreciate you joining. We have a number of people who have joined tonight, including our board chair, Wendy Machin, who grew up in Wingham and is on her cattle farm in Wingham, and our federal MP-elect, Alison Penfold. Welcome, and welcome everyone who's attending. I'm going to start by covering a few areas of PHN support and talk about some of those non-financial and financial supports, and then hand over to Lani, who's been really good enough to join us to share some direct insights and information from the Reconstruction Authority. Thanks, Phoebe. We'll go to next slide. Firstly, to say this was a weather event that took us by surprise, a significant rain event. For us, we saw within our region some major and moderate flooding impacts along the Manning through Wingham, Taree, Harrington, Old Bath, Kalongalook River, from Kalongalook itself through to Foster Tuncurry being isolated, the Patterson and Williams rivers, the Williams impacted by the Chichester Dam spillage, and some significant flooding, particularly around Dungog and some other towns nearby, and Barrington, Gloucester and Wallumbilla Brook rivers, Gloucester particularly flooded for us, and then down through the Hunter River a little bit more subsequently. And some additional low-lying impacts for us around Tuggerah Lakes, Lake Macquarie and the Port Stephens area, which were all flooded to certain extents. So it was a much bigger scale than we initially expected, and was a much bigger response, which continues. Thanks, Phoebe. We'll go to next slide. To run through a couple of PHN areas of non-financial support that we've been particularly focused on. Initially, we focused on status checks and welfare checks with general practices, and then pharmacies and aged care. Based on the scale of the disaster and emergency, that was what we felt we could resource initially, and then over the past week, we've also been reaching out to allied health practices. We've really tried to coordinate support, so our role frequently in disaster and emergency is as a conduit of information to emergency response services, so recovery services, Reconstruction Authority, but also the statewide Emergency Operations Centre. So that's been a key part of our work, so feeding the information that's coming from you into those key organising authorities and agencies. We have been trying to update the National Health Services Directory around practices and pharmacies that are open and closed. That has gone reasonably well, but not as well as we would have hoped, so some work for us to do ahead of next time. We have had on-call GPs to potentially cover evacuation centres. And particular thanks to Dr. John Goswell, who was on call throughout the initial emergency response, but also to the other GPs who are on the register to cover evacuation centres. This was an issue that was compounded by the number of isolated towns and evacuation centres for this disaster, so that added a degree of difficulty for us. And we have been trying to communicate daily with all relevant stakeholders, clinicians, practices where we can, as much as possible. So there's some of the non-financial supports that we've been trying to provide as a PHN. Thanks, Phoebe. We'll go to the next slide. Around some of the financial supports, I'll just talk through these for you. So very early on in the disaster, we provided funding to extend opening hours for primary care practices, particularly general practices and pharmacies. Some practices felt able to do that and take that up, and pharmacies, and some just didn't. But it did allow us to support an extra 35 hours of general practice and pharmacy support, and that was really appreciated by us for any of those practices and pharmacies that were able to extend their hours. We have then, over the past week, started providing business continuity support grants. So that's $1,000 per practice, and that is really for those general practices, pharmacies and allied health practices who were forced to close during the emergency. And we know that some are still closed. So that was just a rapid interim grant. We have been also offering our member assistant program of counselling support to primary care providers, staff and immediate family members as well. And so you're very welcome to continue accessing those. The We're Open grants and the business continuity support grants are open until the 10th of June, so after the long weekend, so a little bit more than a week to go on those. We do, as a PHN, of course, commission mental health services, so we're really keen to continue to respond to emerging needs, and we are keen to seek additional funding for additional mental health services and supports for those most impacted communities. And we're particularly concerned about the communities in and around Taree, Wingham and along the Manning. And we do want to continue to hear from you about any impacts for you, what that means in practice, and the barriers to opening or to you operating your practices. And we will continue to try to link you with the best supports and support you as needed. So we're really keen to continue to hear from you. So they're the key financial supports that the PHN has been and is providing at the moment. Thanks, Phoebe. We'll go to the next slide. So it's a very rapid update from the PHN. Please keep in touch. We're really keen to hear from you. You're very welcome to hit the Alert the PHN tab at the top of our website. You're very welcome to email our disaster management email address, the PHN, which Ellen monitors as our Disaster and Emergency Coordination Manager. And you're very welcome to call Ellen directly on the available mobile phone number. So I'm going to stop there. I do need to hand over to Lani McNeil, who's it's terrific that Lani has joined us from the New South Wales Reconstruction Authority to run through in detail the supports that you are able to access from the New South Wales Government. So thanks, Lani. I'll hand over to you.
Thanks, Richard. Good evening, everyone. So my name's Lani. I'm with New South Wales Reconstruction Authority. So my role is Manager Social Recovery Coordination. Been working in this space for many, many years now, and I'll acknowledge that I am joining you from Gumbaynggirr country and want to pay my respects to Elders past, present, and also recognise that the land we live and work on was never ceded, and really want to acknowledge the all of the efforts going into supporting community at present, and also just recognise their ongoing connection and caring for country that they have been doing and will continue to do for thousands and thousands of years. So thank you. Reconstruction Authority, we've officially gone into sort of recovery mode as of today. So we do have a dedicated recovery website, which we have been updating sort of since the event began, but essentially we have really been still in that response mode, so leaving a lot of that coordination up to the SES and just supporting, I suppose, in that recovery planning space. But former New South Wales Police Deputy Commissioner Dave Owens has been appointed as the Regional Recovery Coordinator, and he officially started today. So keep an eye on those recovery updates as they come through. We're putting information up there. All the locations for recovery centres and outreach are on that website. I've also popped them in the slides there as well. So I have included the Mid-North Coast and Hunter regions. So Phoebe, if you want to go to the next slide. We do have some static recovery centres. So we've got these 4 locations: Taree, Kempsey, Wauchope, Maxville, and we've also got Maitland, which is just on the next screen there. We've set those up as static recovery centres, which means essentially that they're going to sort of maintain, and what we're also doing is some recovery outreach. So we've got outreach at Wingham, Raymond Terrace, Gloucester, and some more locations which are on the next screen. We'll make sure to share all of these and the website as well, so you know where to go depending on what works for you and your service. But essentially the recovery centres host a range of services within them. So we have legal aid, we have New South Wales Health, we also have the St Vincent de Paul and Salvation Army providing some financial assistance in there, and generally the outreach locations will be a stripped back version of that, and we're working closely with community groups and community organisations to understand the needs in each community and try and tailor some of the services that attend those outreaches. So in terms of the recovery centres, we've had over 2,000 people come through the doors to our recovery centres so far. And a lot of the supports you can access within those recovery centres, you can also get online. So I'll just go to the next screen, which will, next slide, sorry. So there is a range of financial supports that the people you're supporting or yourselves may be eligible for. So we do have the East Coast Severe Weather Personal Hardship Assistance Grant. So that is on the Service New South website, and all the links are embedded into the slides as well. So when they're shared around, you'll be able to access the links direct to each of the pages. The personal hardship assistance is $180 per eligible individual and up to $180 per dependent, up to a maximum, of $900 per application. And those applications are open until the 26th of June. So really important, we're encouraging people to jump online and apply for those. Check the impacted areas when you're going through the grant application, or before you get into the grant application, there's an impacted areas site that you can check on, because we're essentially the eligibility is based on suburbs, and that's all based on sort of impact and identifying those things. But if you do come across anything, we're happy to take feedback around those things as well and provide that feedback across. So we've also got a disaster relief grant. So this is support really is for, I guess, the most vulnerable in community. So it is an income and asset tested payment. There is a household and contents sort of grant, and then a structural repairs grant that goes along with this. So this one, there are quite a lot of pieces of documentation to supply with this. So there is a fact sheet which I'll share with Phoebe to share with you all as well. But all the information is on the website there. But that's really income and asset tested and uninsured. So there's a few eligibility criteria to that one as well. Then we also have the Australian Government Disaster Recovery Payment, and recognising this is a sort of federal level grant, but I thought I would share that as well because it has become available. It's not available in every LGA, so it's just really important to check the website and have a look at, which local government areas, are included in that payment. And that's the $1,000. So that really looks at your structural house damage. So if you've had damage to the home, essentially you can sort of apply for that to support, and there's no income test on that one. Then we also have the Australian Government Disaster Recovery Allowance. That one's to support short-term income support for people who've lost their income due to the disaster. So we know that we've had many communities isolated, and some people might not have been able to travel to work and could have been impacted in that way. So that recovery allowance does support people to apply for up to, I think, 13 weeks for that one. So again, just checking local government areas for that. So we'll just go to the next slide. And I want to recognize as well that there's so much information and so much support out there that can be a little bit overwhelming sometimes to kind of take all this information in. So I do really encourage, just going to our flood recovery update website and just having a look through that when you get an opportunity, because there is a lot in there. One of the key supports that people are asking for at the moment is really around emergency accommodation. So people can visit a recovery centre or recovery assistance point to be supported with emergency accommodation, or they can contact Service New South Wales and they'll be put through to the Housing Contact Centre. Also wanted to just highlight watching out for scammers. So we get lots of around this time when we, enter into that disaster recovery, and there's lots of people putting their hands up to help. Scammers are quite quite prolific, I suppose, in terms of trying to, reach out to very vulnerable people. So it's always good to be wary of that. And there is some information on the website around that. We also know there's been a huge impact to rural landholders and primary producers. So there are some supports available for primary producers and rural landholders. And I've put the links in there as well. Recognising that there is the survey, so the primary industries and natural disaster damage assessment survey. So if you can encourage, farmers and primary producers to fill that in, so we can kind of get an understanding of what the damage assessments are looking like, and recognising that at the moment, we're still going through and looking at the impacts and what's happening in the community. So there is still some work in the background there around how we apply for and what we sort of look to fund moving forward through this recovery as well. So the more information we get from that, the more that we can advocate. I've also put a link in there to the Environment Protection Authority. So that's just around waste and cleanup and those sorts of things. But essentially all of that you can find on our flood recovery website. We'll go to the next slide. Please, thank you. So we have partnered, or the New South Wales Government has partnered with GiveIt. So GiveIt is an organisation supporting us to manage donations of essential goods and services. So essentially, GiveIt will be a coordinating agency. They've set up an appeal which covers the Mid-North Coast and the Hunter regions, and is specifically aimed at ensuring that community gets the support that they need when they need it. Other organisations, so community organisations and community groups, can sign up to be registered with GiveIt, which means that you can log a request for an item with GiveIt, and they'll source the item for you essentially. So they'll do the background work. So you could upload things like requests for pharmacy vouchers, or you might request support for transport or fuel vouchers so people can get to their medical appointments and things like that. So we GiveIt are doing some training sessions this week. So if you sign up to register with GiveIt by tomorrow, there'll be information sessions that they'll take you through how to use their service and how to log requests and those sorts of things. We can go to the next slide. So this is just a couple of details. This is current as of Friday. So there's a lot of community pop-up hubs that have sort of sprung up across the regions. GiveIt and the RA have sort of been providing sort of advice and guidance to them, particularly around, accepting donations and those sorts of things. So as of Friday, the GiveIt appeal had up to $135,000 and $24,000 had been spent. We're still getting organisations who are signing up. So we've got new organisations signing up with GiveIt, which is really great. So really encourage, if you are coming across people who need support, to go on to GiveIt and see if you can provide some support in that way. I think that might be it from me. I'm happy to take any questions. My contact details are there. And just really want to say thank you to everyone on the call and all the service providers out there, because I know that you really are on that front line supporting people, and many of you may be impacted personally as well. So really thank you for all the incredible work you do supporting communities, and always happy to take a phone call. So thank you.
No, thank you. We haven't had any questions come through, so Ellen does have a very easy job this evening. I wanted to thank both of our presenters, appreciating that you do have a 9 to 5 job and some days a 9 to 9 job, and you've taken the time to put together your presentation and spend your evening with us. We really do appreciate it. To everyone who is here, all of our attendees, thank you so much. We again appreciate that it is dinner time, it is after work time. On bad days, it's extra work time. So we do really appreciate you logging in and spending your evening with us as well. I'd just like to say thank you to Lani and Richard and Ellen, of course, and look after yourselves. Thank you.
Thanks, Phoebe. Thanks for
Thanks,
hosting
Phoebe.
us.
Thanks, everyone, and all the best.
Thank you.
Thank you.
Thank you.